Hospitalizations continue to rise. That is a trend that is, again, troubling. We are looking at the percentages of each region, how many cases, as well as how many hospitalizations. We're not where we were, but we're not looking to break that record from April 12th. That is not what we're striving for. We're hoping that, similar to what we saw in South Africa, that it goes up quickly. And this is not that wave we saw last year. It kind of kept going up and up. This is straight up, and love to see it come straight down. We just don't have a time on that, but we're doing all we can. And again, we have many more defenses this time. 1 year ago, vaccinations were scarce. They were going to people in nursing homes and essential workers. Everybody was saying, when can I get that vaccine? Just 1 year ago. The vaccines are so plentiful. They're out there. There's no person who cannot get a vaccine in the state of New York. So we are in a far better place. So just to put this in perspective. So we're looking at a critical moment, but we also we're going to start asking some questions. We talk about the hospitalizations. I have always wondered, when we're looking at the hospitalizations of people testing positive in a hospital, is that person in the hospital because of COVID, or did they show up there and are routinely tested and showing positive, and they may have been asymptomatic or even just had the sniffles? Someone is in a car accident, they go to the emergency room, they test positive for COVID while they're there. They're not there being treated for COVID. Now, someone's conditions can worsen while they're in the hospital. I'm not saying that won't happen, but I just been doing a random call around to some of the hospital leaders that I touch base with, and I'm seeing numbers from 20 to sometimes 50%, but we don't have clear data right now. That's anecdotal. Beginning tomorrow, we're going to be asking all hospitals to break out for us how many people are being hospitalized because of COVID symptoms, how many people happen to be testing positive just while they're in there for other treatments. So I think that's important. I just want to always be honest with New Yorkers about how bad this is. Yes, the sheer numbers of people infected are high, but I want to see whether or not the hospitalizations correlate with that. And I'm anticipating to see that at least a certain percentage overall are not related to being treated for COVID. But we're still going to watch hospital capacity is still hospital capacity. You either have beds for sick people or you don't. And if you have a heart condition, you don't want to be turned away because the beds were filled with either other people with conditions like that or with COVID. So we're watching that very closely. Right now, Finger Lakes capacity overall is about 14% of acute beds. We dip below. Any institution has 10% or below. It's an automatic cessation of elective surgeries. Last year, it was statewide, regardless of your circumstances. You could have had almost no infections in your area, and elective surgeries were shut down. It does not have to be that way. That was an approach based on not having the resources we have now, like vaccinations and boosters and having widely available test kits. So we're watching that number. And ICU beds, that's a low number. That is a low number. So we're working closely in partnership with our hospitals to get those numbers much higher. Also, what else can we do? We have about 21 hospitals affected by having to not be offering elective procedures right now. We'll see whether that trend holds, whether that gets better. That had started at 32, so we've actually taken hospitals off the list. Some have come off, some have gone on, but at about 21 hospitals statewide is not that bad. But based on what we've seen over this weekend and the numbers that we're starting to creep out, this could change very quickly. We could see a drop soon in our hospital capacity, and at that point, we'll be deciding whether we need to take wider steps, and we're ready to do it, and we have the plans in place. We're just watching this for a couple more days to see what those steps might be.